Hello viewers, thank you so much for joining me on this channel today. Today we will talk about breaking bad news and the scenario is anosmia in a chef. Today once again I will be joined by Dr. Pritha Ghosh, who is a renowned ENT doctor in India who will soon appear in MRCS ENT OSCE. I must tell you once again that breaking bad news is not a station that is explicitly described as breaking bad news during the manned exam of MRCS ENT OSCE. In the manned exam of MRCS ENT OSCE, we are likely to encounter two types of tasks. One is the clinical examination task, where we have to perform a clinical examination like ear examination or nose examination or throat examination or even a flexible nasoendoscopy or otoscopy or vestibular system examination or cranial nerves examination. Any kind of clinical examination pertaining to ENT is fair game when it comes to manned exam of MRCS ENT OSCE. So you have to practice how to perform these clinical examinations in the appropriate manner. The other aspect of manned exam in MRCS ENT OSCE is communication skills. It can either be assessed by asking you to obtain history, or by asking you to obtain informed consent, or by asking you to break bad news, or by asking you to give explanation. You are likely to encounter 4 individual stations in the manned exam of MRCS ENT OSCE, and they will be a combination of the different stations that I have mentioned so far. You might even get composite stations where you might have to obtain history and then perform a clinical examination, or you might have to obtain history and then obtain informed consent in the same station. Each station will be of 7 minutes duration, and you will not be allowed to look at your watch. In fact, you will not even be allowed to carry a watch when you are performing the task. So you have to practice to teach yourself to finish each task within 7 minutes. So time management is key, but you cannot skip any important discussion that you should have with the patient while communicating. So you have to express accurate clinical knowledge while communicating, as well as you have to communicate in the right manner with the patient, as in you have to express the right emotion at the right time. You can't talk to the patient like a robot. You can't talk to the patient like a medical student who is just recalling the medical knowledge. So you have to treat the patient as a patient and you have to play the role of the doctor. So 3 things you need to keep in mind in the communication skills stations in the manned exam of MRCS ENT OSCE. You have to keep in mind time management. You have to keep in mind that while communicating with the patient, you have to express the right emotion at the right time, and you have to mean it, because the patient can see your face. If you are just saying words and you're not meaning it, the patient will be able to understand by just looking at your face. And the third thing you need to keep in mind is whatever you say while communicating with the patient should be in line with the clinical guidelines. You can't say something that is not recommended medically. So if the patient asks you what is the treatment of anosmia in this case, you have to say something which is actually a treatment. You can't make things up. You can't say something which is not acceptable medically as of the date of your exam. So just to recap, 3 things you need to keep in mind in the manned exam of MRCS ENT OSCE: time management, accurate clinical information, and right emotions should be expressed at the right time. With that out of the way, I must declare that these videos that I am uploading on YouTube, they do not reflect 100% accurate information in terms of how you should answer this question in your MRCS ENT OSCE manned exam, because this is a practice session. You are allowed to make mistakes during the practice sessions. You are even allowed to make mistakes during an exam, but the penalty for making mistakes during exams is failing in the exam. So this is just a practice session. It's full of mistakes, but to the credit of Dr. Pritha Ghosh, it is not completely full of mistakes. I would say it is 80% accurate, But the viewer has to remember that this is a practice video. It is not 100% accurate. It is just a suggestion about how you should practice, because if you don't practice, then you can't reach the level where you will be certain of passing MRCS ENT OSCE. So this is my attempt at teaching you how to practice. It is not my attempt towards teaching you exactly how to answer on the day of your exam. Okay, if when you keep practicing repeatedly the same topic, you get better. I do not upload the second practice videos of the same topic. This is just the first practice video, so it will have some inaccuracies and I want the viewer to be aware of it. This is true for all the practice with Pushpen videos. There are inaccuracies here and it is meant to be taken as how to approach these stations, how to practice to prepare for these stations, not as the definitive answer to these stations. So with that disclaimer out of the way, I must tell you that each Breaking Bad news station has a set template in which you can approach it. We will talk about that template first and then we will talk about the example that we are going to talk about today with Dr. Pritha Ghosh. I hope you will like this video. If you want to practice with me, I'll leave my Instagram handle at the end of the video, and then if you want to practice with me, you can reach out to me and we can set up a mutually convenient time to practice clinical scenarios on Zoom. However, my suggestion would be to practice with someone who is going to appear in MRCS ENT OSCE with you. That way, both of you have an equal incentive to practice seriously. When you play the role of the patient, then you can be strict with the time and you can give accurate feedback to the person who is playing the role of the doctor. And when you are playing the role of the doctor, the other person playing the role of the patient can monitor the time and give you accurate feedback as a person with knowledge of ENT when you are done with your role play exercise. So this gives an equal incentive to both the people practicing for MRCS ENT OSCE. Of course, if you have any doubts, if you have any confusion, if you want to seek any kind of guidance from me, please reach out to me in the comment section below and I'll be more than happy to answer your doubts if I can. So with that out of the way, let's get into the meat of the discussion. Mnemonic time. The mnemonic for how to approach Breaking Bad news stations is spikes. Let me explain this with the help of an example. Hello, I am Dr. Puspen Dasgupta. Are you comfortably seated? Do you want any family member to join you during this conversation? Let me assure you that I have submitted my phone to my secretary and we will not be interrupted during this conversation. Can I invite the specialist nurse to join us during this conversation? Are you comfortably seated? Do you want to continue the conversation here? This is setting. I have ascertained that the conversation is taking place in an appropriate setting. Now perception. Before we discuss this further, could you tell me what you already know about the condition? This is understanding the existing knowledge that the person you're talking to has. Invitation. So I have the report with me here. Do you want me to share the report with you now itself, or would you like me to tell you on some other day? Knowledge. Disclosing the bad news. Unfortunately, the report that I have does not reflect good news. I wish I had better news for you today. I really hope I had a better thing to tell you today. This report is not good. So it is a good idea to start disclosing bad news by giving a warning shot. These were examples of warning shots. Once you declare the bad news, such as, I'm sorry to tell you, but you have cancer in your voice box, the response from the patient can be one of denial. This cannot be true. It can be of sadness. Oh my God, what will I do now? It can be complete silence. It can be tears. Patient can break down in front of you. Whatever is the reaction, You should allow the normal reaction, the natural reaction to play out. Do not interrupt. You can say helpful things like, I can see this is a big shock for you. I know this is very difficult for you to hear. And you have to mean it when you say it. You can't just utter platitudes. You have to mean what you say. Once the patient has gained composure, then you have to further describe the plan of management. That is called summarizing the situation or providing a structured plan. Let us discuss this with the help of an example.
Today, once again, we will practice breaking bad news. Look at this scenario. Does this look like bad news? Again, it depends on the recipient of the news. In this case, a 49-year-old chef will soon find out that he may lose his job. In this scenario, Dr. Pritha Ghosh will break this news, explain the further plan of management to a 49-year-old chef who has complaints of anosmia. I will play the role of the chef. As per MRCS ENT OSCE rules, Dr. Pritha Ghosh, you will have 7 minutes and your 7 minutes starts now.
Hello, I'm Dr. Pritha Ghosh. May I speak? I'm an ENT surgeon in this hospital, and may I speak with you?
Yes.
Could you please tell me your name and date of birth, please?
My name is William Smith and I'm 49 years old.
All right, William. Is it all right if I call you William?
Yes, that's fine.
All right. I see that you have had some complaints of with your nose, with the problem of smell. Could you please tell me in details what you already know about your condition?
So I don't really know why this is happening. All I know is that for about 3 months, I can't smell anything. And this has severely affected my work. As you may know, I work as a chef. I have been laid off for the last 2 weeks, and my boss has said I need to fix it. And if I don't get it fixed, then I'll probably lose my job. So I'm really stressed.
I can understand this is a legitimate concern, and I know that this is causing a lot of trouble. But I'll try my best to help you feel better. If you could just bear with me. Since how long have you been having this problem?
3 months.
All right. And are you alone or are you with somebody?
I have come here alone.
Would you like to call somebody to join you here?
No, I'm fine. Thank you for asking.
And are you comfortably seated?
Yes, I am. Thank you.
Well, I'm really sorry to tell you, but reports that we have with us are not as we expected.
Oh, what do you mean?
I'm really sorry to tell you, but your ability to perceive smell has been affected, and it could be because of a nerve affection or it could be due to some nasal problem.
But which one is it?
We'll have to do a few more tests to be exactly sure why that is happening. But your smell, the sense of smell could actually come back to normal in a few weeks or months. But sadly, sometimes this damage could be permanent.
Could you tell me what are the possible causes of this?
Well, I understand that this is causing a lot of trouble, but let's not focus on why it has happened and let's focus on how to get you better. But there could be a way, if you would like me, and I would tell you the various issues that actually could lead to this problem. Like there could be some nasal polyps in your nose, those are fleshy masks that occur because of nasal infection. There could be some sinus disorder, and there could be some damage to the nerve that carries the smell. These are just the basic. There could be many more, but these are the basics that actually could cause this problem. But we are not sure yet. I'm so sorry to tell you that.
Could it be due to a viral infection?
Yes, that could be too.
Because I had COVID 3 months before, 3 months back. So
Mhm.
I'm thinking maybe it's because of COVID.
Yes, it could be because of COVID, as we know that COVID does have the side effect of affecting the nerve that carries the smell. And this sense of smell that is affected, it could also affect your sense of taste. It could actually change your taste perception as well. Has that happened to you?
Yes, you are very right. That has happened with me. So, if it is due to COVID, is it one of those causes that can be remedied?
Well, it is be till now there we are not sure if these with COVID if the smell comes back or not. But in most cases, it does come back. But sadly, it could be a permanent damage. But
What?
we'll try to offer some help in forms of nasal sprays or nasal drops, and we will also try to give you some smell therapies that might actually help you to regain your smell.
And what happens if my smell does not come back?
Well, sadly to say, but as you're a chef, you might have to consider changing your job. I'm so sorry to say that. I'm so sorry that I had to break this news to you today.
Hmm. And do I have to take any precautions?
Yes, there are a few precautions that you have to take, which are very important. You have to get gas detectors fitted in your home. And do you use a gas stove or gas cooker at home, or is it an electric one?
I have an electric one.
Well, that's good then. And you are, it would be better if you pay attention to use by date food materials, and please keep dated dates written on the cartons of the food on the day you open them.
Mhm.
And I would advise you to eat a balanced diet and to maintain your health, because it is also affecting your taste, so you might not want to eat. So please remember to eat healthy food. And I would also politely like to remind you that you need to pay attention to your personal hygiene as well.
Mhm. Yes, that makes
Am I
sense.
able to? And there is a website known as the Fifth Sense, which actually supports people who have this problem with smell and taste. If you want us, we can help you register on that site. And if you do want us, we could also help talk to your employer about your condition. Would that help in any way?
Um, would you help me if I lose my job?
Well, we could help you to register on this website, which actually help people affected by this smell and taste disorders. And we'll try our best to help you get your life as comfortably as possible. No
Hmm.
matter what, we are here for you, and we'll help you in every possible way we
Thank you for reassuring me.
can. Thank you. Thank you so much. Is there anything in particular you would like to ask me?
So, if it is not due to COVID and due to polyp, can it be treated?
Well, if it is due to some nasal problems, then we will have to look at it. And yes, if it is because of polyp, there are chances if the disease is cured, then you
Okay,
might have your sense back.
that is the time.
All right.
Thank you so much for watching this video. I hope you liked it. Ideally, if you want to do well in the manned exam of MRCS ENT OSCE, you should practice with someone who is also taking MRCS ENT OSCE with you. That way, both of you have an equally strong incentive to do well and to practice regularly. While practicing, when you are playing the role of the patient, you can monitor the time and you can give a reasonably accurate feedback to the other person, and the roles get reversed when you are playing the role of the doctor. However, if you can't find anyone to practice with before your MRCS ENT or ski manned exam, please don't make the mistake of not practicing with anyone. If you end up practicing with yourself standing in front of a mirror, say, then that is possibly a recipe for disaster. I'm not saying nobody has passed without practicing. I'm just saying that many people have not passed and have pointed out they did not pass because they did not practice adequately. In my opinion, the only disadvantage we have as doctors who are trained outside the United Kingdom with respect to doctors who are trained inside the United Kingdom when it comes to MRCS ENT is the communication skills stations in MRCS ENT OSCE manned exam. Everywhere else we are at par, if not better. Why are we at a disadvantage in the communication skills stations? It is because most of us are not in the habit of communicating with our patients in our clinics, in our medical schools in English. We communicate with patients in the local language. We may have read medical textbooks in English. We may have communicated with our friends in English about different aspects of treatment, but we don't communicate with patients in English. That is why people trained in the United Kingdom have an edge. The only way to make up for this disadvantage is by practicing repeatedly, and that is why I am uploading these videos. This is how you should practice, and if you practice repeatedly, then you will improve, your answers will become accurate, and you will also be able to manage time properly and express the right emotion at the right time. I hope you like this video. Take care, and I hope I'll get to see you soon in the next video. Bye bye.